Diarrhea, characterized by the frequent passage of loose or watery stools, is a common but often distressing condition. It can affect people of all ages and, although usually mild and self-limiting, can sometimes lead to severe dehydration and other serious health issues if not properly managed. Diarrhea is usually caused by a virus or sometimes contaminated food. Less frequently, it can be a sign of another disorder such as inflammatory bowel disease or irritable bowel syndrome. Travelers' diarrhea is the most common illness that affects international travelers. It's usually related to a bacterial infection from consuming contaminated food or water. It's especially common in hot and/or humid climates, where bacteria breed more easily. Most of Asia, the Middle East, Africa, Mexico, so travelers there are more often affected. The causes of diarrhea are varied and can include infections from viruses, bacteria, or parasites, frequently spread through contaminated food or water. Food intolerances such as lactose intolerance and chronic conditions like irritable bowel syndrome, IBS, or inflammatory bowel disease, IBD, can also trigger episodes of diarrhea. Additionally, certain medications such as antibiotics can disrupt the natural balance of bacteria in the gut, leading to diarrhea. The signs and symptoms of diarrhea extend beyond the obvious frequent loose stools. Individuals may also experience abdominal pain, cramping, bloating, nausea, and an urgent need to use the bathroom. In more severe cases, fever and blood in the stool may be present, indicating the need for immediate medical attention, especially in vulnerable populations like young children and the elderly. Effective management of diarrhea begins with maintaining proper hydration. Oral rehydration solutions, ORS, are often recommended to replenish lost fluids and electrolytes. Eating a bland diet, often referred to as the BRAT, bananas, rice, applesauce, toast diet, can help ease digestion during the acute phase. Resting and avoiding stressful activities are also crucial during recovery. Prevention. Prophylaxis can be achieved by the following measures: isolation of proved cases, disinfection of excreta, clothing and bed linen of the patient, protection and treatment of carrier, prevention of fecal contamination of food and water. Treatment varies depending on the underlying cause. For infectious diarrhea, antibiotics or antiparasitic medications may be necessary. Probiotics can be beneficial in restoring healthy gut flora, especially after antibiotic use. In cases where diarrhea is a symptom of a chronic condition, managing the underlying disease is essential to prevent recurrent episodes. Metronidazole is definitive treatment. 800 mg 3 times a day is given for 8 to 10 days. Over-the-counter medications like loperamide may offer relief, but it is advisable to consult a healthcare professional before starting any medication. The epidemiology of diarrhea highlights its global impact, particularly in low-resource settings where poor sanitation and limited access to clean water are prevalent. Diarrheal diseases are a leading cause of morbidity and mortality, especially among children under 5. Organizations such as the World Health Organization, WHO, and UNICEF have ongoing initiatives to improve sanitation condition. With appropriate care and preventive measures, many cases of diarrhea can be effectively treated, significantly reducing the associated health risks.